I call him Mr. Polio. I have known Raj ever since I entered Rotary, and since that time, in 1998 to 2016, he has served as the polio chairman 16 times in that period. Raj Jadoo was inducted in the Rotary Club of St. Augustine in 1987 and served as its president in 1993, their 25th anniversary at that time. And in order to mark that auspicious occasion, his club was instrumental in sending 25 children for open heart surgery to New York. They fitted out 25 elderly patients with pacemakers, and he encouraged 25 of his members to donate to a Paul Harris Fellow in that year. He also started the Jaipur leg, for which the club became synonymous over the years. He was named Rotarian of the Year in District 7030 in 1993 to 94. In 2002 to 2003, he received the International Service Award for Polio, a Rotary International Regional Service Award for a polio-free world in South, North, and Central America, including the Caribbean. In 2003 and 2004, he received the District Governor's Citation for Meritorious Service for Polio Eradication. In 2007, from Rotary International, he received the Rotary Foundation Certificate for Appreciation. He also visited Barbados, where the Rotary International president presented him with the Outstanding Service Award and the Meritorious Service Award. He has received the Significant Achievement Award from the Rotary International president. But Raj is someone who puts his money where his mouth is. And I witnessed in April 2013 at the district conference in Grenada, where he challenged Rotarians and clubs to give to PolioPlus and asked them to match as he put his money forward in pledging money for the PolioPlus program. Raj managed to raise 100,000 US in 10 minutes at that function. On a national level, he's the recipient of the National Hummingbird Medal Silver for community service. He's been the president of the Arima Business Association, and he's a former director for Habitat for Humanity. In May 2017, the Shaman Dharma Mahasabha renamed the El Dorado North Hindu School of 580 students the Raj and Sati Jadoo El Dorado North Hindu School. He's an entrepreneur, having formed several businesses on his own, and is married to Sati for the past 35 years. He has 3 children and 3 grandchildren. He and Sati are both level 3 major donors to the Rotary Foundation, with 3 diamond pins each. He has contributed 55 Paul Harris Fellows, and likewise all his children and grandchildren are Paul Harris Fellows, all having been donated to the polio program. I have always been in awe of his passion, and he certainly is someone who is a hard act to follow.
DG Lai, PDG Leslie Harry Paul, PDG David Edwards, PJ and Sonia Allen, PDG and Leslie Ramdani, District Trainer Nigel Lacqui, Past President of the Rotary Club of St. Augustine, Maria Mohammed Maharaj, fellow presenters, Virginia and Debbie, fellow Rotarians in District 7030 and 7020. As you all know, I am very passionate about polio. And then when we look at the first slide, it tells a story all by itself. That is polio, the forgotten killer. Forgotten to many, but is still a threat to children of the world. Next slide, please. Support functions of the Rotary District 7030. PolioPlus Subcommittee supports Rotary commitment to polio eradication and encourages participation in PolioPlus activities. Polio does not respect geographical or political borders, so that we have to take cognizance of the fact that so many people have to surmount borders, carry polio vaccines to some of the most remote areas on the face of this earth. Next slide, please. Goals, go back here. Goals of PolioPlus subcommittee, that is education and public awareness, increasing donations to the Rotary Foundation, fundraising activities, and also to have functions for World Polio Day, which is normally celebrated on the 24th of October every year. So I would come back to those in a short while. Next slide, please. Rotary is a core partner of the Global Polio Eradication Initiative, established in 1988, 3 years after Rotary launched the PolioPlus program in 1985. You will also see there the Bill and Melinda Gates Foundation, who joined in 2007 and made their first contribution of $100 million. When you see Gavi, which is the Vaccine Alliance, they only joined recently, that is December 2019. So polio partners with Rotary, World Health Organization, Center for Disease Control. Next slide, please. When you look at this graphic picture, it tells you what polio is in truth all about. It is a tenacious disease that affects the motor neurons of the brain. It is infectious. It strikes at any age, typically children under the age of 5 years. It is due to poor and careless hygiene. Symptoms is fever, fatigue, headache, vomiting, stiffness. And what we have to learn from those machines that we have seen is that the bottom is the line. As long as polio threatens even one child anywhere in the world, all children, wherever they live, remain at risk. The iron lung, as you have seen, was to help children and adults in breathing. Most people spend their entire life in an iron lung chamber. As a matter of fact, up to today, I was researching, and one Philip Alexander, since 1954, is in one of those chambers, and he's still alive, and he resides in Texas. So that tells a story all by itself, and that is since 1954. Next slide, please. This is a short video on the surveillance system for polio produced by the World Health Organization and its partners, including Rotary International. Maria, you got you?
Virus begins with a sick child. One day, Amina wakes up unable to move her arm and leg. She is showing symptoms of acute flaccid paralysis. Her parents travel with her to the nearest healthcare center. Each case of acute flaccid paralysis acts as a signal that polio might be circulating. Because polio lives in the intestine, the health worker collects 2 stool samples from Amina. 146 World Health Organization accredited laboratories around the world test around 200,000 stool samples from people with paralysis every single year. From this vigilant testing, 99.99% of stool samples come back negative for polio. But that tiny fraction of positive results tells the World Health Organization where the virus is hiding. Epidemiologists gather to analyze the data that is collected through the polio surveillance system. The answers they find help to predict the best way to stop the virus. In more than 70 countries, the World Health Organization helps to keep this system going. In this way, we can keep children like Amina protected from polio in the future. The work of thousands of people make the polio surveillance system the most extensive of its kind. From the most remote villages to conflict zones to huge cities, they find and stop the polio virus wherever it exists.
Next slide, please. There's no cure for polio. It can only be prevented. Do you know that more than 10 million children will be paralyzed in the next 40 years if the world fails to eradicate polio? We owe it to our children and the children of the world to get the job done. What we have done in 2004, we were able to immunize 170 million children in India in one day. 170 million children were immunized in one day, and Africa, some 25 million. That would tell you the extent of which the Rotary and its partners go to make sure that polio is eradicated throughout the world. Next slide, please. When you look at the map there, the world map, you will see that in 1988, the infrastructure resulted in the reduction of polio cases from 350,000 cases of polio per year in 1988 to 176 in 2019. The number of endemic countries of polio in 1988 was 125. In 2019, only 2 countries were reporting cases of wild polio virus. That is Afghanistan and Pakistan. And Nigeria has not reported a case of wild polio virus since 2016. So they have to wait 2 more years to be certified polio-free. When you look at 2020, we have only 54 cases. That is 43 cases in Afghanistan and 11 cases in Pakistan. And when you look at the map, you would see the 2 areas here in red, in the deep red, that is Pakistan and Afghanistan. But when you look at Africa, you see Nigeria is of a lighter color. Likewise, the whole of Africa is of a lighter gray, so that we are still looking at the African continent because we can never tell what could happen at any given time. Next slide, please. When we look at this map, we entered 2020 knowing that we had challenges to address and overcome to stop transmission of polio in endemic countries and sustain and build on progress in other areas. Then COVID-19 pandemic has been a curveball that nobody could have anticipated. And when you look at the map here, you could see more or less it shows up just as how polio was years gone by. This is a recent map that shows the countries affected. It is reminiscent of the map from the early days of our fight against polio, a virus that has impacted life throughout the world and which, like polio, was not well understood and initially lacked a preventative vaccine or effective cure, therefore placing an extraordinary public health threat to communities and burden the health system throughout the world. COVID is a public health emergency. Due to the unique nature of COVID-19 and the way the virus spreads, immunization activities, particularly mass immunization campaigns, including those for polio, has been paused. It remains to be seen how long this disruption will last, but it will most certainly result in more vulnerable children and probably an increase in polio cases. We were unable to immunize for the past couple of months some 80 million children. The focus required to combat COVID-19 pandemic will also divert already limited and finite human and financial resources. Next slide, please. When we look at the polio infrastructure, it supports the COVID-19 response. PolioPlus, the plus in PolioPlus, Global Polio Laboratory Network, testing for polio and COVID-19. When we look at places like Pakistan, where we had so many problems, where our volunteers were killed, now there is a call center, and they are receiving calls from even the Taliban about COVID-19 and also for polio. Next slide, please. The polio infrastructure supports COVID-19 response. The plus in PolioPlus continued. Community mobilizers educate on polio and COVID-19 prevention. The logistic officers for polio vaccine facilitate distribution of personal protection equipment, which also now carries the polio logo, which is End Polio Now. We have hundreds of thousands of healthcare workers who are moving from door to door and surmounting borders to make sure that every child is immunized against polio. And also, we are trying our utmost, because Rotary has built the base of polio eradication, so that we could continue doing the work in the prevention of COVID-19. What they have done in Nigeria, Pakistan, and Afghanistan, they are giving out soaps so that they can educate the people about washing their hands ever so often and changing clothes and having the right sanitation in and around the environment. Next slide, please. Next slide, please, Maria. Yeah. Rotary National PolioPlus Committee supports COVID-19 response. The plus and polio vaccine carriers provide by Rotary used to transport COVID-19 specimens, like in Pakistan, also Afghanistan. Rotary Polio Resources Centers have been used as COVID-19 testing sites, which is a plus also for Pakistan. And there are food rations provided to needy families, both in Pakistan and in Nigeria. So that the Rotary International is very much involved with COVID-19. They have set aside a couple millions of dollars to assist with COVID-19. Next slide, please. Rotary National PolioPlus Committee supports COVID-19 response, providing personal protection equipment within polio logo now, as I said before, and they are now repairing ventilators in Pakistan and Afghanistan. Rotary established Polio Ulema, a committee which is religious leaders in India, and they are totally focused on COVID-19. As you know, just as well as I know, COVID-19 would be here for a while until we get the right vaccine. And we have several countries in the world that are working on that presently. But we'll have to live with it for a while. Next slide. Polio work continues. Bottom line and call to action. Be proud that polio eradication infrastructure that Rotary has helped build in supporting COVID-19 pandemic, as it has for natural disasters such as Ebola, yellow fever, SARS, avian flu, etc. COVID-19 pandemic reminds us of the polio epidemics. Rotary's dual priority to support COVID-19 and polio eradication. Next slide, please. Bottom line and call to action again. We are to raise some $50 million is a fundraising goal for also the Rotary year 2020-21 and fully leverage the Gates Foundation 2-to-1 matching grants, more or less. District designated funds match 2-to-1 by the World Fund and then 2-to-1 by the Gates Foundation. Beginning immunizing children as soon as possible, requiring full Rotary leadership and encouragement. It is said that during the course of this month, we are going to restart immunizing children against polio. Next slide, please. Rotary District 7030 call to action. Education and public awareness. Increasing awareness of PolioPlus amongst Rotarians, Rotaractors, interactors, and also general public, especially relative to the fight against COVID-19 and other similar diseases. The onus would be on us to make sure that we get all the media involved so that we could educate the general public about polio and COVID-19. Next. The frontline health workers remain mostly women and they work tirelessly, some 100,000 workers, speaking to mothers about the effect of polio and also the vaccine. Also, we have thousands of medical officers assisting, and they are just doing this from service from their heart. As they say, service to man is service to God. We in District 7030 would like to realize a sum of $100,000 to be raised throughout 2020, 2021 towards the PolioPlus program. Next slide. Increase member donations to the Rotary Foundation. PHF incentive program to encourage members in District 7030 to donate to the Rotary Foundation. PolioPlus fund, that is some $25,000 cumulative contributions from members in District 7030 to the Rotary Foundation. The PolioPlus and PHF incentive program during the 2021 Rotary year, what I would like to do, PD July, is that I am willing to give 25,000 points that I have, which could work out to 50,000, because I would be given 500 points to Rotarians, and who would put 500 US dollars instead of the $1,000, so they can become a Paul Harris Fellow. That therefore would give us a surplus of some 25,000 US dollars. So we are left with some $75,000 so that we could raise. Hopefully, we are to speak to all the various clubs at a later date so that they can get some of their members who are on the periphery of becoming major donors. And if we could get them to become major donors, and if we could get other members of the Rotary fraternity and friends to make a contribution towards polio eradication. And hopefully, we are looking at about $30,000. And then we have a difference at $35,000. And with that 35,000 US dollars, I would like that every Rotary Club have a fundraising event for polio eradication. And I would like to let you know one time PDG line is that from that $35,000, I would cut that down to 30,000, because I would take an additional I would contribute an additional 5,000 US dollars from beginning July to polio eradication. Next slide. To arrange and execute various fundraising activities, of which I already said, and I explained this because I want every Rotarian to understand that this disease is that we are doing it for our children and for the children of the world. And I am appealing to every Rotarian to try the utmost and see what best that they can do so that we could help eradicate polio from the face of the earth. We as Rotarians should stand proud and to know that we were part and parcel of this global initiative to get rid of polio throughout the world. We have to end polio now, and the onus is on each and every one of us. We would like that every club, as I mentioned, to have a fundraising project. And we are also organizing here in Trinidad a virtual telethon with some prominent artists on World Polio Day, which will be on the 24th of October 2020. That was going to be something very big, of which past President Maria, myself, past President Vishnu Balu were involved, but it so happened that COVID-19 came and put a damper. But we would not give up. We will still try to do our utmost and see what it is we can do to raise some funds for End Polio campaign through the telethon. There are so many Rotarians who would like to become major donors. The time is now. As I said, we are on final inch. We are so close. We are so close. Even self that you have to sacrifice and do something to save the children of the world. Be a true Rotarian and try to make that sacrifice. If you look at the picture on your left, you would see that we had a big walk against polio 2 years ago, and that was last year, and that worked very well. And Also, that is a project that could be done by all the various Rotary clubs so that you could educate and sensitize people about polio. There are so many people outside there do not know what polio is. Polio is really a surge that could damage this world at any given time. What I would like to do now is to end and ask every Rotarian to just remember that there is absolutely no cure for polio. It could only be prevented. And to the world, we are just one. But to one, we are the world. And just remember, the world is one family. And we are the ones in a position to assist the needy. I won't say the less fortunate, the less needy in society. And the onus again is on us to make sure that we help our children and the children of the world. Because all polio needs is a boat ride, a plane ride, no passport, no visa, to start all over again. And because of COVID-19, we have to be even more vigilant and stronger to save the children of the world. Thank you, God bless, and looking forward to the support of every Rotarian in District 7030 and all Rotarians throughout the world.